Are you having back pain? Is it in the middle of your back or is it one-sided low back pain? Maybe it's caused pain in your buttock, or maybe it's caused sciatica pain. Whatever it is, if you are having low back pain, there are so many things you can do that can help you. And you can find a lot of those out on this channel. But what I really want you to know is that if you're having back pain and it hasn't gone away, a lot of the times it can be rooted in your pelvic floor muscles. Have you heard of the pelvic floor muscles? These are muscles that are located inside your pelvis. So they're a little bit weird to talk about, honestly, because people don't like to talk about the functions that the pelvic floor controls. So it controls bowel movements, it controls peeing, it controls sexual function, it controls orgasms. And yeah, people don't like to talk about that stuff. But what it also does is it really can control your low back pain. So if these muscles have something wrong with them, then they can create and cause low back pain and even hip pain. And so when we get low back pain, or if we have a low back injury, maybe we herniated a disc, or we bent over funny, or we swung a golf club too weirdly, or we picked up a kid, that can cause low back pain. Well, what happens when we get low back pain is that our muscles start to spasm. And maybe you take muscle relaxers and that doesn't really help. It's not treating the root cause of the issue. But what also happens is that the pelvic floor tightens to try to give stability to these low back muscles and vertebrae and joints like the discs. So when you have pain in the low back, so if you imagine these little spines going up from the back of the sacrum up, you can have pain in any area. And when you have low back pain, your pelvic floor, everyone's pelvic floor, tightens to try and support the low back vertebrae and the muscles. Well, even if you heal the low back and the issues with the low back, you still end up with a tightened pelvic floor that hasn't relaxed. This can perpetuate the low back pain. It can take the natural curve away in the spine because when the pelvic floor tightens, it pulls this bone underneath and makes it so it's hard for you to get a neutral spine posture, which would look like this. So if I'm standing, so a neutral spine posture would be like this. Imagine my ponytail's getting pulled up to the ceiling and my curves are natural. Well, when I have low back pain, a lot of times I'll go into this position, so a little bit of a tucked position, and that is going to cause significant tension through the pelvic floor and through the buttocks. A lot of times we squeeze our butt as we have low back pain to try and support the low back. A lot of times also we might go into this like anterior pelvic tilt where we stick everything out and forward, and that's what helps our low back, or that's what we do to compensate for the low back pain. So when we're in either of those postures, that can create some serious tension through the pelvic floor and through the hip. It doesn't typically go away naturally because it's not an area that we're used to controlling. So we don't know how to naturally relax this area and or relax these muscles affecting this area. So what do we need to do to get this back pain gone? We need to work on relaxing the pelvic floor and opening up these muscles. Now, this might be completely opposite of what you've ever heard. You maybe have heard that like you need to do Kegels to let go of these back muscles or to help support these back muscles. And the reality is that anyone who's experienced a back injury or hip pain is experiencing tension through the pelvic floor. And they do not need to be doing more contraction to create more tension inside their back. They need to be relaxing these muscles so there is less pull on the actual back itself. And if we can get these muscles back to their normal positions, then they're going to work a heck of a lot better. So it is normal for the body to compensate with this pattern, which is a tight pelvic floor, these shortened pelvic floor muscles, and that can create the chronicness of any low back injury. So if the low back pain, you had the initial injury, but then it just kept coming back and never really went away, it's the pelvic floor muscles that need to be helped and addressed. And we help people with this every single day. A lot of times people don't come to us until after they've had a back surgery that didn't work. And it's because they did a surgery on the back that really, if they just addressed what was happening in the pelvic floor, would take off all all the pressure in the world off the low back and help prevent that back pain. So it's very connected to the low back. You can even see from the inside of the pelvic floor, the very deep layer of which is the third layer of the pelvic floor. There's 3 layers. The first layer, the second layer not shown here, but is between the first and second layer. The first and third layer. And then we have the third layer here, and the third layer is connected to the tailbone and also to the hips. And when these muscles are really tight, they're gonna pull on that low back and can give you that low back pain. It can be right-sided or it can be very central. So anyone with low back pain should absolutely get their pelvic floor worked on and checked out, because that can save you years and years and years of chronic low back pain and also help get rid of the symptoms fairly fast. And what happens when we don't have the pelvic floor in its normal position, in a lengthened position, meaning that the pelvic floor is tight and squeezed? What happens is that if it's not in a normal lengthened position, every time your foot hits the ground, we need the pelvic floor to be in a lengthened dynamic position so it can do this piston-like shock absorption. But if it is just contracted and tight, then it can't do that shock absorption. And then what happens is the joints are going to do and absorb those shocks, leading to more back pain, more hip pain, more joint pain, more joint surgeries, more joint injections, and not treating the root cause of that low back pain, which oftentimes is that pelvic floor. So I highly recommend that if you have low back pain, you absolutely need to get your pelvic floor checked, or you're going to get into that cycle of years and years and years of chasing that low back pain. Now, there's another layer to this, that if you have any scar tissue on the abdomen, that could be affecting the front part of your core, and that could be limiting your ability to activate the right core muscles that support your back. So if you've had a gallbladder surgery, an appendectomy, a C-section, or any surgeries that I haven't listed, even a laparoscopic surgery that goes through the belly, I highly recommend working with a pelvic expert physical therapist who is going to treat that scar tissue as well, because that in itself can take off a ton of pressure off the back. We use shockwave therapy at the clinic to help dissolve and disintegrate any remaining scar tissue on the abdominal wall from any previous surgery to help restore the core function of the belly and of the deep core muscles. And that can work so well with the pelvic floor to regain its ability to be a shock absorber and take the pressure off the low back. I'm Dr. Allison Felt. Thank you so much for joining me today. I hope you have learned that if you have low back pain, your pelvic floor needs some help, and most likely unlocking your pelvic floor is going to cure and heal your back pain for life. Thank you so much. Please subscribe and like this video. Leave me a comment and I will respond personally to your comment on the video. And I hope we can help you here. We have clinics located in Edmonds and Poulsbo, Washington, and you can fly in from anywhere in the world and we will get you set up for some care for that week. And we call that an intensive, where you come and get intense therapy for a week and we help cure your low back pain. Thank you so much for joining me. Cheers to a great life, living well, feeling well, and honestly, just being yourself again and getting energy back, because we all know that when you have back pain, that makes us cranky and that makes us not as fun to be around, and therefore we don't have the energy to want to be around everybody. So in order for you to get your life back, fix that low back pain and you'll feel so much better. We can't wait to be a part of your journey. Take care.